Treatment options for people with stage 4 cancer are often limited, but UAB is the first in Alabama to offer a new treatment. It's called heated chemotherapy. Joining us now is Dr. Salila Hashmi with UAB's Division of Surgical Oncology. Great to see you this morning.
Thank you for having me.
I'm so encouraged by this, and some people will find hope in hearing that there's a treatment for them with stage 4 cancer. So what is heated chemotherapy and what does it entail?
Yeah. So it has essentially two parts to it. It's really called a cytoreductive surgery and heated or HIPEC, as people may have heard,
right,
which is the short form for hyperthermic intraperitoneal chemotherapy. And so the first part really entails removing all the visible tumor. So I usually tell patients all the tumor that I can see and feel. That's what we're removing, which may include removing the lining of the abdomen or the peritoneum. Also taking some of the organs as well, which could be bowel, uterus, ovaries, part of their stomach, maybe part of their liver as well, or
whatever
spleen.
You need to take to increase their chances of survival.
To remove essentially all visible tumor. And then the second part is once we're done with removal of all this visible tumor, we essentially wash the abdomen with heated chemotherapy for 90 minutes. And it's heated because there's more penetration of that chemotherapy within the lining of the peritoneum. And the role of chemotherapy here is basically that all the cells that are floating around that we cannot see with our eyes, this heated chemotherapy will treat and kill those cells, so lesser chance of that cancer coming back.
That is fascinating. So you're doing the surgery, and while you're in there, it's almost like a rinse. I mean, layman's term here,
yes,
obviously. Not the kind that you go in and have the IV, that kind of chemotherapy. So that's amazing. That is a huge development. What cancers will respond best to this kind of treatment?
Yes, so it's a wide range of cancers that we treat, but appendiceal, colorectal, ovarian, some gastric essentially as well, and also ovarian cancers.
Who can take part in this program? Anyone listening with a loved one who has any of these cancers or been through it, they will all say, please sign us up. How does that work for you all at UAB?
So everyone will not be a candidate, unfortunately, because the tumor has to be where I or our team can remove it.
I gotcha.
There's only that much of intestine that I can take for them to live. So obviously we have a thorough multidisciplinary discussion in terms of which patients will be eligible for this treatment. And one thing I also want to mention, that this is more of a localized treatment. The patients may still require the systemic or the IV chemotherapy before or even sometimes even after the surgery, because again, we don't want the cancer to be treated here and then come back elsewhere, like in their liver or lungs, again. So
I am so encouraged by this. About 10 seconds. Are you hopeful for the future of this treatment, that it will expand?
Absolutely. I think there has been a lot of research going on. This started about 40 years ago.
Really?
And so, sort of every decade we see some change happening. And I think in the future we'll see more of minimally invasive techniques taking over, and be able to do it with smaller incisions rather than doing it with a big large incision.
Bless you all at UAB for the work you do. Great to see you this morning,
Thank you
Doctor.
so much for having me.